like to call upon the last speaker of today's session, Dr. Abhishek Kumar, who will be presenting on a rare differential of Leukocoria Medullo epithelioma.
Good morning, everybody. So I would like to present a case on a rare differential of leukocoria. As we all know, there are 10 to 12 differentials of leukocoria. In our case, it happens to be medulloepithelioma. So the history of present illness, the informant was mother, and it seems to be reliable. There was a 2-year-old female child presented with complaint of, the parents presented with complaint of leukocoria in the left eye since 2 months. And it was insidious in onset and progressive in nature. It was not associated with proptosis, trauma to the eye, any exposure to pets, or any deviation of eyes. The birth history, there was no significant any oxygen supplementation. Immunization history was within normal limit, and there was no family history of any other ocular malignancy in the child. So on examination under anesthesia, the visual acuity in the right eye fixation to light was present, and it was done on the OPD basis. And in the left eye, the child was not fixing to light. Right eye was within normal limits, and left eye, the lid and nexa was within normal limits, and there was a circumciliary congestion was present. Anterior chamber was irregularly shallow. The lens, there was a whitish mass with vascularization which was present over it, which is distorting the iris and involving the anterior chamber. So here's the clinical CP. There was a posterior synec, and the nasal, there is distortion of iris with the iris atrophy. And also there was a mass kind of thing which was present posterior to the iris. It was abutting the lens, and there was the pupil was non-reactive, and there was also presence of neovascularization of iris. On fundus examination, the right eye was within normal limit. There was no details visible in the left eye. On the gonioscopy, we found some whitish lesion near the angle. So it it could be a anterior chamber seed, or it could be a mass. We didn't know at that point of time. On IOP, the left eye was 38 mm of Hg with bitoxolol 0.5% BD. So we made a provisional diagnosis of intraocular mass with NVG, neovascular glaucoma. On ultrasonography, there was a 6.6 into 4.7 of mass, which was, there was no high amplitude spike suggestive of calcification. So we, in anterior RB, there are also very less chances of calcification. And heterogeneous ovoid anterior mass was there near the ciliary body. On ultrasound biomicroscopy, there was a intratumoral cysts which were present, at which we can see, and it is abutting the lens, causing the distortion of the iris. And there was some displacement of lens also present. So we made a provisional diagnosis of medulloepithelioma. And on MRI, there was a T1 hyperintense, T2 hypointense with patchy enhancement. So anterior RB can also be a condition. So we have to just look into mind that there are few differentials of pediatric ciliary body mass, like medulloepithelioma. The age of onset was corresponding with the patient. In melanomas, there are epithelioid spindle cells are present, and there is no patchy enhancement which is present. In anterior RB, calcification may or may not be present. So medulloepithelioma is a rare differential, and it is originated from non-pigmented ciliary epithelium derived from the optic cup, and it is seen in children and rarely in adults. Zimmerman hypothesis suggested the derivation it to be a partially differentiated embryonic ciliary epithelium, and it is more commonly unilateral as in our case, and DICER1 mutation can be associated with few syndromes. Thank you.
What is the most important thing which you have to keep in mind while treating a patient of medullo epithelioma?
Ma'am, in the medulloepithelioma generally presents like this only, like a pediatric ciliary
It's
body
a
mass.
typical presentation. What else do you have to think in, keep in mind in treating the patient? Did you work up the patient for any familial associations?
Yeah, we worked up that bronchopulmonary. There was no associated. There is a syndrome associated with
Familial
it. Yes,
cancers
there
are
was no
associated with
familial.
it.
There were no
Yes.
familial cancers. Family history was within normal limit and no
And
affection.
intracranial extension has also to be ruled out properly in these patients. In generally, when you are treating
Yes,
them,
ma'am.
that extensive and proper neurological consultation is mandatory for these patients.
Thank
Did you do the PERB1 gene in this case?
you. This patient was non-affording in our case, but yes, RB1 gene can be tried in these cases, but there are chances that even if it is RB, then 50% only sensitivity is there. So
So how
that's
did you manage this case, Abhishek?
so we did a enucleation for this case because the eye was non-seeing. It was neovascular glaucoma with a medulloepitheloma. We didn't know at that point of time, so we did a histopathology. The neuroglial cells were present with a cartilage, so it made out the diagnosis of teratoid variant of medulloepitheloma.
So it conformed with your
Yeah.
diagnosis.
Thank
Thank you. Thank you.